Hi, I'm Marty Jolly, Director of Nursing from Dakotabilities. As a nurse for us, you're going to have to replace feeding tubes from time to time. Sometimes they get pulled out on accident, sometimes they're due to be replaced, or sometimes they get clogged. So in any of those situations, I want you to know how to handle it. But trust me when I say it's actually a pretty cool process and easy to do. The important thing to remember is that a feeding tube is going into the gut. So the gut is not a sterile place. So you don't have to follow a sterile procedure, you're going to follow a clean procedure. So keep that in mind, not sterile, but be as clean as you can. It's going into the gut, and bacteria goes into our gut all the time, and things that we eat or things that fly into our mouth, right? First thing we want to do is hand hygiene, okay? So I'm going to go, if I have a sink, I'm going to wash my hands with warm soapy water. I don't. I've got hand sanitizer, so I'm going to get a good sized dollop of that. I'm going to vigorously rub that into my hands until it's completely dry, okay? Once my hands are completely dry, I'm going to put my gloves on. While I'm putting my gloves on, I can go to the MAR and double check what feeding tube size I'm going to be putting in for the person, and then how much fluid is going to go into that feeding tube balloon, okay? So I've gone to the MAR. I know that I'm going to be replacing this Mickey with this size tube. I'm going to be putting 5 cc's of water back into the balloon. So I'm going to come to the person. I'm going to have their head raised a little bit, but I don't want it to be uncomfortable for them. Sometimes a person might ask you to replace their tube when they're up in their chair. If you can do so without issue, that's fine, but sometimes you might have to recline them back a little bit. This position right here is going to be okay for me to replace this feeding tube. So I'm going to go ahead and access the site just enough so that I can see the feeding tube. My preference personally is to use a towel anytime I'm doing something with a feeding tube to prevent from making a mess around the site when I'm doing this process. I've got my new tube, so I can go ahead and I can peel open that container with the new tube and the supplies that I'm gonna need. I've got some water, I always have some of that on hand. I've got a med cup, and I've got some towels as well, okay? So this is the old tube, and I'm gonna take this one out. Now, it's okay if it's a minute or two in between when I remove the old tube and put the new one in, but I wouldn't want it to be an extended period of time. That's when we find that our tubes and our holes, the hole starts to kind of close up, or sometimes it does close up too far and we have to start with a smaller tube before we can get them back up to the regular tube. If the hole shrinks too much while the tube is out, sometimes they have to go into the ER to have it replaced. But hopefully for you, this is a situation where we're just going to go ahead and replace a standard replacement, okay? So I'm going to take my empty little syringe, and I want to empty the fluid out of the current balloon so I can take the old tube out, okay? I'm just taking my syringe, twisting it in there on the balloon port. So the balloon port is the port that says BAL on it, BAL for balloon. I've got my syringe connected securely, and now I'm going to go ahead and I'm going to pull back on that plunger, and I'm just going to hold it there for about 10 seconds while I'm waiting to see if there's any more fluid that's going to come out. I've got it. I've got all the fluid out of there that was in the balloon. Now I'm done releasing the old, okay? So I can just go ahead and dump that fluid aside because I'm not going to need that with the next part of my process. The next thing I can do is I can go ahead and I can remove the old tube. But what I want to do is I'm just going to wait and make sure that I have everything else ready to go before I start and pull the old one, because sometimes stomach contents are going to leak out depending on how full that person is or how slow their GI tract moves. So just keeping the tube in place until I'm ready to go can help prevent a mess as well. In this situation, this is the kit that comes with a new Mickey. So whenever they send out a new Mickey or a replacement for that person, then I'm going to have this kit that I can use to replace it. First thing I'm going to do is grab the new Mickey. I'm going to make sure that the size is correct based on what the physician ordered. When I flip open the flap on top, it tells me what the size is. So this is a 20 French, 3.5 centimeters. So 20 French is how wide around this tube is. 3.5 centimeters is how long it is, how far it needs to go into the body. We don't want it to be too long because then it could stick to the tissue on the back of the stomach. We want to make sure we have the right length and the right size of tube for this person's needs. So I double checked, I've got the right tube for this person. I can also check to make sure what the orders are as far as cleaning the site in between cares. So it might be maybe a mixture of peroxide, it might be warm soapy water that I'm using. So in this scenario, I've got a warm soapy washcloth that I'm using to cleanse the site in between. So I've got my new tube ready to go. So I'm gonna go ahead and I'm gonna remove the old tube. And so by that, I'm just pulling slowly at the site. I don't wanna do it too quickly. And sometimes, even though the balloon is completely suctioned in, it can kind of stick to the tissue around it. Sometimes if you're having troubles, you can spin the tube a little bit to get it to release from any parts of the body that it might be getting stuck on. Then I can go ahead and I can pull that out and that will be thrown away, okay? I've got my warm soapy cloth. I'm gonna start when cleansing closest to the open area and then cleanse away. I don't wanna be bringing bacteria across and wiping it toward the opening. I always wanna clean closest to it and then clean out and away from it. Got another warm soapy cloth here. I'm gonna do that again, cleansing out and away from it. Now it's time, I'm gonna go ahead and take my new tube and put it into the site. Okay, I'm gonna ask the person to relax for me. All right, I want you to go ahead and relax because that's gonna make it easier to put this in. The balloon is not filled up at this point in time. So I'm just going ahead and I'm gently pushing in until I get it inserted into the person's stomach. I've gotten the tube down into the person's stomach. I believe it's in the correct position. Now I need to get my 5 cc's of water because that's what the orders are, to have the balloon filled with 5 cc's. Remember, this is going into the stomach, so it doesn't have to be sterile. Got my 5 cc's for my balloon. I'm gonna twist the syringe into place, slowly fill up the balloon. While I'm doing that, I'm always keeping an eye on my patient. If this person seems to show signs of discomfort or they're having any sort of trouble while I'm blowing up that balloon, I'm gonna stop, I would release and pull that water back out, and then I would probably reinsert, make sure I don't have any issues, and then I would slowly fill the balloon again, okay? So it might just be that the tube was stuck somewhere on the side of the stomach or something like that that was uncomfortable. So by pulling it out and resetting it, and then filling the balloon again, I've got no discomfort signs. I should be in the right place. Now what I can do is I can fill my syringe with water. I can grab my extension for the tube that came with it. So I've got my new extension. I'm gonna clamp the extension, okay? I'm gonna go ahead and connect my syringe to the end of the extension. And then if the extension has a secondary port, you wanna make sure and close that as well, because otherwise the things that you're putting in will come out that secondary port. Now I'm just gonna unclamp it and push the water out until I get to where water's all the way through the tube. Now I can clamp it again just by squeezing. I'm gonna come over to the person. I'm gonna pull the tab back on the top of the low profile device, and I'm gonna go ahead, and there's a line on the top of the extension, and there's a line on the low profile device. I'm gonna match those lines up. So I match them up, and then I'm gonna turn clockwise. And by turning clockwise with those matched up, I've locked this into position. So now if I try to pull up on this extension, it's not gonna separate from the feeding tube. Now I can go ahead, unclamp it, and I can flush water into the tube to make sure that the water goes in and the person doesn't show any signs of discomfort for me while I'm slowly doing that. So I'm just slowly gonna insert that water in, make sure it goes in okay without any signs of issues. Looks like it's going well, and I'm not seeing any water coming outside around the site. So it looks like we've got proper placement, but I'm gonna just keep doing that until I get all 30 cc's in. All right, I've got all that water in, no signs of any issues with it. I'm gonna go ahead and disconnect my syringe. Now I can close the cap on the tubing, because I'm done with that. And then I just need to turn this counterclockwise until the lines on the extension and on the low profile device match up, and then I can just disconnect it. So the last thing I did was flush this with water. So I can now open the clamp, and I can open at the top. Any water left in there is going to drain out. I can just lay this on a paper towel, and I would put that with this individual stuff because this is their extension only. And so this will just dry on a paper towel until the next time I'm ready to use it. When I'm done with the site, I want to close the cap on the site. I'm going to clean up if there's any mess or anything. I've got more towels. And then there are some individuals where the physician will order to put gauze around the site. In that scenario, one of the recommendations is instead of cutting the gauze, what you can do is actually fold it in half and put half under one side of the tube, and then take another piece and fold it in half and put that under the other side of the tube, and then you can take your tape and tape that down. And then anytime those get leaked on or start to get dirty or soiled or anything, you can just take that gauze out and replace with new after you've cleansed the skin and patted it dry. If you notice that a person's site starts to get red, like this site here, generally what's going on is they're getting moisture that's coming out of the site and draining onto the abdomen and causing a fungal infection that looks kind of like a rash on the top of the skin. In that scenario, the best way to prevent that is always going to be to stay on top of the moisture that's leaking out around the tube. So we need to ask ourselves, are they getting too much feeding too fast? Is their body having trouble moving the feeding through the GI tract? If that's not the issue, and we literally think it's just that we haven't been putting gauze under it, then let's make sure to get maybe those pre-cut 2x2s ordered and around it to keep the moisture off it. And then we want to recommend to staff, they change those and check those frequently and replace them as soon as they get moist so we keep the moisture off the skin. Keeping it dry is what's going to heal this up the quickest. Thank you so much for your time.